New tonight, D.C. is changing its response to monkeypox. The city will now give people one dose of the vaccine instead of two, at least for now. And here's why: a spike in cases and limited vaccine supply. The city spoke about this new plan during a monkeypox town hall this evening. Our John Henry was there as some of our neighbors got their questions answered. And apparently there were quite a bit of them, John.
Yeah, there were many, Leslie. D.C. has one of the highest monkeypox case rates in America, with 172 so far, according to D.C. Health. About 90% of the cases have been spread through the district's LGBTQ community. That's part of the reason why D.C.'s LGBTQ newspaper, the Washington Blade, teamed up with D.C. Health to hold a town hall tonight to answer any questions people may have about this virus.
We need to create forums where we can have honest dialogue about what this means to our community.
And that's what the Blade and DC Health did Monday night, on the heels of some big news from district government.
We've made the decision based on the data of the product to be able to take those doses that were destined to be second doses and make those first doses so that we can get out into the community more.
This panel also fielded questions about what DC is doing to make sure its vaccine rollout is equitable, as the monkeypox vaccine is currently scarce. To that, DC Health announced this news: another vaccine site is coming to Ward 7 or 8.
There is going to be another site opening later this week on the other side of the river.
The town hall also cleared up misinformation about monkeypox. First and foremost, experts reiterated anyone can get the disease.
Viruses don't discriminate. Humans discriminate.
DC Health epidemiologist Dr. Anil Bengala also re-emphasized the virus spreads through skin-to-skin contact. There's been no airborne cases in the U.S. because, unlike COVID, monkeypox molecules are relatively big.
They don't stagger in the air.
They add people who get monkeypox typically have these symptoms along with a telltale rash. DC Health says healthcare providers can test for the illness. However, their patients must have that rash or a lesion for their test to work.
Now, D.C. Health says it's only gotten around 12,000 to 14,000 vaccine doses so far. It said it's hopeful we'll get another large batch toward the end of August or into September. The department added, as they get more vaccine doses, the eligibility of who will be able to get one will likely evolve. Leslie?
I'm sure some people are really happy to at least hear they may be able to get that first dose sooner than they thought. John, thank you. If you already got your first dose of the monkeypox vaccine, or you've got an appointment scheduled, you might have some questions about the city's new vaccine plan. So let me bring you some fast facts we verified straight from DC Health. So the city is only giving one shot of the Jynneos vaccine, and studies show that first dose is still effective for at least 6 months. Now, this doesn't mean you won't get the second dose. The city says it is confident those will be available by the time people who got one dose will need the second dose. People with weakened immune systems caused by conditions like cancer or HIV will still be eligible to get that second dose of vaccine. And if you're looking for more information on vaccines in our area, text the word monkeypox to 202-895-5599, and you'll also find those details on WUSA9.com.